All right, everyone. Well, I think we'll get started. So I just want to begin by introducing myself. My name is Beth Hollander. I am the current SCPA president, and I am really glad to see so many of you here tonight. This is an important matter for us to be discussing, and I am glad to see that you are all here to learn and understand what the MLA is about and to have an open dialogue about this and hopefully you will have a better understanding about what this all means for us as psychologists by the end of this evening. I'd like to introduce the people who are going to be running our town hall this evening, Dr. Madalena Yelico and Dr. Dina Abbey. Maddie is an SCPA board member at large and the chair of our legislative committee. And Dina Abbey is a former president of SCPA and the former deputy chair of the legislative committee of NISPA. So we have some pretty hard-hitting individuals with us today. So I will turn it over to Maddie and Dina. Thank you so much for all that you're doing for us.
Yeah, I'm very excited to have this town hall, and I'm very excited to have so many people to join us. And I'm hoping that this town hall can help to just shed some more insight into the MLA and encourage engagement with the portal and commenting and understanding the importance of the current MLA. I've had a lot of support in trying to understand it myself. Um, I've spoken to a few different other psychologists in the field, including Dr. Oppenheimer, who is actually here on the meeting tonight, and he has been part of he's been the liaison to the current model licensing task force, and so we had a lot of information to share, and so that was very helpful. And I've also spoken to the representative for the New York State representative to APA, and so I've gotten a lot of support in trying to understand this, and I'm hoping to share the information that I do have. So for tonight, I'm trying to make it as informative as possible. I have some handouts and I have a PowerPoint, and then we're also going to go through the commenting portal. So hopefully that guide of visually seeing us go through the portal can help to make it a little bit more understandable. If there's questions, feel free to ask them as we go through the presentation. So as they come up, feel free to ask them. You can also put them in the comment section and we can try to sort through them at the end. Dina, anything you want to add before we get started?
No, I think it's our job here is not necessarily to sway people, just to have us explain to you kind of, or Maddie explain to you and me support her and cheer in the background, what the MLA says, and then go through the portal because it's a little difficult, maybe to log on and to comment, but it's unbelievably important that if you can, you do. If you have any questions after we've gone through all of this, and you still don't understand, Maddie and I would be happy to sit down with you and kind of go point by point, hold your hand while you attempt to comment on the portal. But it's really important that if you are able to comment, that you do. So thanks.
Yep, absolutely. We want to encourage everyone to have their own informed opinion and share that opinion with APA. Okay. All right. So I'm going to just pull up the PowerPoint that I have. And the PowerPoint is adapted from Dr. Oppenheimer. He was very helpful in sharing some of his slides with me, and then I added some additional slides. So let me get this started. Forgive me, I've never used this for my own presentation on Zoom. So, okay. Can you see the PowerPoint now?
Yep, Maddie, if you go up top and you hit the note on the PowerPoint, you can, after it's saved, yep, you got it.
Got it. Okay, so everyone can see the full slide?
Yep, we're good.
All right, very good. So we're going to get started. All right, so just start off with, and if you need this later, this is just a link to the commenting portal. I'll go into that at the very end. So first I'm going to go through the MLA. So just a little overview of what the MLA is. So it is APA's recommended guidance to the states on psychology licensure. All right, so it represents the discipline's collective thinking about what effective psychology licensure should include. Right. And so just in general, it's a lengthy document. It's 23 pages, and it goes through the scope of practice, the educational requirements, the licensure requirements. And so it's APA's summary of what should be included in order to license someone in this field of mental health. Okay? And so it's not binding to the states. APA puts this out as a suggestion, so it doesn't bind the states. The states separately will make their own laws around licensure. However, a lot of times states will look to APA and to the MLA, the Model Licensing Act, as a way to get guidance for how to make their licensure laws. So the APA first developed this in the 1960s, and then the last time it was updated was in 2010, right? So it's been a bit of time before APA has updated it, and so this is a significant update. All right, so the reason why it is important is because APA, as we all know, is such a significant organization, right? APA is one of the largest scientific and professional organizations of psychology in the world, right? And so it has a lot of influence. It's over 190,000 members, right? So it holds massive influence over what we consider professional standards, clinical practice guidelines, education, and public policy. All right, so it really does function as the voice of mental health, and a lot of legislators look to APA for guidance. Okay. Oh, sorry. I don't know why I did that. Okay. So this has been shared with me that currently there is an anti-regulatory movement overall in the United States and Canada. So in general, even outside of the world of mental health, there has been a bit of a movement towards having less regulation. And so this has been discussed with me as a concern now with these new revisions that are coming out, right? Just because in general, it's a little bit more of a vulnerable time, right? And so in making these revisions, we want to be conscientious of not only how is this impacted in the mental health field, but overall in the current climate. Another concern with the MLA is that it only had superficial consideration of overall how is this going to impact the field, right? So in general, it seemed that the understanding was that there needed to be an update of this, but there wasn't as much of thought into after it was updated, how is that going to impact psychology? How is it going to impact the mental health field? What are the long-term repercussions of this? In general, from my understanding, there has been little research on the impact, right? And so it doesn't seem like there's a lot of research that's backing up why these changes are being put in place. And I'll go through the different changes. And then another concern and why this is important is that overall, it seems that engagement in it to make these revisions and trying to just format that as best as they can for the field. In general, currently, there is less than 1% of people who've even commented on the connection for the MLA, right? And so that just gives a little bit of insight into the small amount of members and staff liaisons involved in this, which is why it's so important for us to comment and to share our perspective. Okay, so according to APA and some of the articles that I've read and the people that I've discussed, these are the reasons that APA is updating the current MLA. All right, so one of the main expressed reasons is that there's such a need in society. All right, so currently there's such an increase in the need for mental health providers, and APA is wanting to update the MLA in order to allow for more people to be able to be licensed in the field in order to meet this need. Okay. Another reason that APA is saying that they are updating this is because there already exists a number of master's level providers, right? In fact, each year there's over 20,000 new graduates from master's level programs, right? And so there's a significant amount of master's level providers. However, there isn't an overall national guideline on how to regulate the field, right? And so APA would like to be able to be part of this, of regulating the field and creating a consistent standard. Also, with bringing in master's level providers into APA, APA is hoping to have their organization grow, which APA is hoping will give them an additional ability to really like be present in the legal and in the legislative sphere, and also to advocate for mental health. And then finally, one of their stated reasons is just to bring the field up to date. So again, it hadn't been updated since 2010. And so to bring the field up to date, to try to match this multi-tiered system in the mental health world and even in general in the medical world, they're hoping to create a master's level degree. Okay. Any questions so far? Or Dina, do you want to add anything?
No, I think no, I think if anyone has any questions, certainly about the history, Dr. Oppenheimer or I could kind of have some discussions on that later though. But I so far we should keep going.
All right, very good. Okay, so to go into the changes. So the changes are really threefold. So one is there is going to be an inclusion of new guidance for psychological licensure of professionals with master's degrees in health service psychology. So that is probably one of the biggest changes, is this addition of guidelines for regulating master's level providers. Another update is guidance for doctoral health service psychology licensure. So there is new wording around some of the requirements and guidance and titles around licensure for psychologists as well, or using the title of psychologist, I'm sorry. So that's the third piece, is delineation of the use of the titles associated with each licensure category. And so we'll go into that a little bit more because it does describe who can use the title psychologist. Okay, so I'm going to go through these as they come up in the documents, or go through them in order. So the first big change, and there's a lot of things that are in this document, so I really encourage you to read it. I'm just highlighting the ones that have been pointed out as some of the bigger changes, some of the most commenting on. And so I have gone through every comment that is currently in the APA commenting portal, and I have kind of did like a qualitative analysis a bit of what are all the different concerns that are being expressed. What are themes that are coming up? What are the items that most people are expressing concern or support for? All right. And so that information, in addition to speaking to some of the psychologists who are more involved in this, I've put that together to really highlight what are the items that most people are speaking about. So the first one is the new title for a master's level provider. So the new proposed title is Licensed Practitioner of Psychology. Okay. And I have here where it states that in the MLA. Okay. So some questions that are coming up around this title is this title appropriate? Does this title appropriately distinguish between a master's level and a doctoral level provider? Right? How will the general public relate to this title? How will they understand it? Okay. So these are questions that are coming up, questions for us to consider when commenting about the new title. Okay. Another concern that has come up is that in the new MLA, they have incorporated additional, I guess it seems like a limitation to the use of the title doctor. So in general, the MLA does state that the title doctor can only be used by a doctoral level provider, right? And that the term psychologist can only be used by a doctoral level psychologist provider. However, it did incorporate this line that some people found concerning. So the line is that a psychologist may use the title doctor. Okay, so they have the ability to refer to oneself using the title doctor, provided that the use of the title is not misleading to the public. Right? So the reason why concern was expressed about this one line, this sentence, was because it seems unclear of who will determine when the title doctor is considered misleading. So a point that was brought up was psychologists that might be in a medical setting as an example. So if you are a psychologist that's in a hospital, if a medical doctor says that, or some other provider says that it's confusing for a psychologist to be called a doctor, would that then limit the title doctor? So the concern really is, does this line open up potential limitations to psychologists using the title doctor? Okay. All right. So the next item, the MLA goes through the master's level scope of practice, and it states what exactly a licensed practitioner of psychology, so that would be a master's level provider, what they would be able to do once they are licensed. So it does state that these master's level providers will be able to work independently. And included in being able to work independently, one of the uh, one of the abilities that they will have is the ability to diagnose. And so I have included here the actual quotes from the MLA. You can scope of practice in connection to diagnosis and treatment. And so the questions that has come up with this ability granted to a master's level provider is whether or not a master's level provider with 2 years of training would be sufficiently trained in order to diagnose. Because as we know, diagnosing an individual can be very difficult. There's a lot of overlap. It's a complex area, right? So will they be adequately trained for this? And again, I'm presenting these as in that these are questions that have come up, and I'm hoping to encourage discussion around these questions so that each person can make their own assessment when they're commenting in the portal, right?
Maddie,
Another
can you
piece of
just
the scope of
explain?
practice.
Wait, Maddie, can you just explain why you're putting the line levels, the line numbers there? Why that's important?
Yes. Yeah, absolutely. So I wanted to see the actual wording from the MLA. In addition to that, when you go into the comment portal to state your comments, they would like you to specify the lines that you're commenting on. So it seems that MLA is really hoping that MLA, APA is really hoping that whoever comments is going to be as specific as possible, right? They want you to state very specifically what you agree with, what you disagree with, and then specific suggestions to change. So even, for example, with the title, they would like you to give suggestions for a title that you find appropriate, but they would like you to use the specific lines in the documents. All right, so that's why I have here the lines that are listed. So the numbers are the lines, and then it also is in sections. So then you'll see definitions and different items underneath definitions. So that's why that's all included. Any question? No, it doesn't. I'm sorry.
No, that totally answered my question. Sorry, you're good. Thank you.
Oh, okay. All right. Very good. All right. We'll continue. Okay. So another item in the scope of practice is that the MLA grants assessment privileges to master's level providers. They do have in their documents exceptions. So they do have certain assessments that master's level providers would not be able to administer. However, it does give a good scope of an ability to administer assessment measures. And so I'm going to show you the specific lines from the Model Licensing Act so that you would be able to see these for yourself and understand exactly what the MLA is saying in regard to assessment. But before I go into that, I just wanted to bring up some of the questions that came up around this privilege. So there was concern that this scope of practice for assessment measures was very close to what a doctoral level provider can administer, so that there was not potentially significant distinction between the scope of practice. And in general, a similar question as with a diagnosis. Does 2 years of training adequately prepare a master's level provider for the assessment privileges that are listed in the MLA? All right, and so this is the specific wording. All right, and so, all right, the provision of psychological screening, interviewing, testing, and assessment for the purposes of diagnosing mental and emotional disorders, mental, developmental, intellectual disability, substance use disorders, disorders of habit or conduct, as well as the psychological aspect of physical illness, accident, injury, disability, or chronic health conditions, risk assessment, treatment planning, intervention, and outcome management. Evidence-based assessments consistent with training, including psychoeducational, cognitive, psychodiagnostic, intelligence, achievement, vocational, and aptitude testing, provision of psychoeducational evaluation, planning, therapy, and remediation services. Okay, so in general, like scope of assessments that they would be able to administer, assessment work that they would be able to engage in. And then I have here the exclusions that are listed as well. So these exclusions would master's level providers would not be able to engage in. So the exclusions include comprehensive specialty and subspecialty assessment and consultation, which require advanced psychology, doctoral or postdoctoral education and training, including the practice of neuropsychology, forensic assessment, child custody, and parental fitness evaluations, medical capacity evaluations, medical pre-surgical evaluations. Acute medical specialty, consultation, rejective testing, and public safety employment evaluations such as fitness for duty. So the question here is really, when you go through this, do you feel that there is an adequate distinction in the scope of practice? Do you feel that what is listed as the privilege for assessment is something that a master's level provider would be adequately trained to do? Okay. All right. And so then it also lists what would be the requirements for a master's level provider. All right. And I will have those listed on the next slide. But again, the question is, do you feel that this training, these requirements are adequate? Right. Now, considering the scope of practice, which includes being able to diagnose, being able to do assessment work, being able to do treatment work, here is the academic requirements in order to be able to do that. All right. So for a master's level provider, the academic requirements include a curriculum of a minimum of 60 semester hours. So that should be a 2-year academic program, a graduate program. It may include distance education, but a minimum of at least 1 continuous academic year shall be obtained in the actual educational institution. Okay. For supervised experience, there could be a total of 800 hours in the program. That include 400 hours of direct service, of which 100 hours can include observation of others, so shadowing or co-therapy. Right? At least 1 direct observation of student clinical work by a supervisor for each specified evaluation period. Right? And they also encourage a practicum. All right. So those are the academic requirements as suggested by the MLA. And then these would be the post-degree requirements for a master's level provider. So it would be a 2-year post-degree supervised professional experience for a total of 3,000 hours, 100 hours of didactic education. And they have here, I'm not going to read all of this, but they have here what those 300 hours, 3,000 hours of supervision should include, who should be able to do those supervisions, right? So what are all the different aspects that qualify? Right. Any questions about this so far? Okay. Okay. Another item that was brought up by a few individuals is the use of the title psychologist in applied psychology. So currently, the MLA states that individuals with a doctoral degree in psychology from an accredited institution of higher education may refer to themselves as psychologists when teaching psychology in an academic institution, conducting psychological research, providing applied psychology services, or providing expert witness services for areas of psychology not specified in Section B.9 of this Act. So this means that in these capacities, you don't necessarily need to be licensed in order to use the title psychologist, right? And so there was discussion around, is this something that potentially could be confusing in the field? Is this something that is appropriate because they still have a doctoral level degree, So is it appropriate for them to still use the title psychologist, or is it something that potentially could be confusing if they are not licensed and therefore not fully regulated by the state and still using the title psychologist?
Maddie, so does that mean that
Okay.
they're not going to need to take the EPPP like the rest of us did? Is that what they're saying? Yes?
Exactly, because to get licensed, you have to take the EPPP, right? So,
Okay.
so if you don't take that, you don't get licensed. But if you're functioning in one of those capacities, you can still be called a psychologist.
Okay. Thank you.
No problem. Okay, now to go to the summary. So hopefully this is a little bit easier. So again, I was trying my best to just summarize what all the comments have been. So I'm not trying to summarize these to try to push anyone in any direction, but just to be aware of, in general, what are some of the concerns. And I also will go in general, what is some of the support to try to have an informed opinion. Okay. So some of the main concerns that were expressed was that the MLA does not adequately protect the public. So there was a lot of discussion around how the titles and the scope of practice was confusing. In general, the word confusing came up in a lot of the comments. And so that was a big concern, is that, especially just in the general public, how will they relate to all of these changes? How will they understand all of these changes? And again, another concern that was mentioned a number of times was the title, right? So again, the title is a licensed practitioner of psychology. Okay, so that would be a brand new title for a master's level provider. And a lot of individuals commented on feeling that this title is not ideal, that the title is confusing. Um, Again, the scope of practice was brought up a number of times, specifically in regard to assessments. In general, a lot of people commented on feeling that the assessment scope of practice was broad and there was not an adequate distinction. There was some commenting on the ability to diagnose for a master's level provider. That was not commented on as much as the assessment privileges, but there was also comment on diagnostic privileges. And again, just uh, overall, kind of the overarching theme was really this like lack of clarification, like the lack of things being adequately defined. Okay. Some other comments, just to try to share and summarize all of the comments that I had seen, was that the MLA and APA does not adequately protect psychologists. So there was concern around, if we are licensing master's level providers who do have such a broad scope of practice, how will that overall affect psychologists? How will that affect individuals who are, seeking to become licensed? Will they want to go those extra years and the extra to become a psychologist to go to a doctoral level compared to a master's level, right? Will that decrease the numbers more? Will it overall be supportive in the field, or will it be confusing in the field? How will it affect psychologists when it comes to insurance, when it comes to reimbursements? Some people mentioned that they would like specific exemptions listed in the MLA, that only psychologists should be able to do medication evaluation, prescriptions, and management, so only doctoral level providers. Some states are moving towards doctoral level psychologists being able to prescribe medication with additional training and with an additional test. And so because some states are moving in that direction, some psychologists commented that they would like the MLA to specifically state that that privilege is only for a doctoral level provider. Okay.
If
Some
that's something you're
individuals,
interested in, sorry, Natty, if that's something you're interested
no,
in,
go for it.
NISPA has a committee that has been working very hard on this, and you can certainly reach out to them. And on top of that, I know some people who have taken the course and have taken the test, and it is unbelievably difficult. It's basically getting another master's level in psychopharmacology and having to pass another licensing exam. So it's very, very hard. But NISPA has a very active committee on this, so you could seek them out and reach out to them. They can give you more information.
Yep. Another concern, another comment was that there should be more in-person requirements for training and supervision. So you had seen that The MLA stated that 1 year had to be at the school and that it was open to more virtual supervision and virtual training. And so some individuals expressed concern around that. Some individuals expressed concern about the supervision requirements, that in general, they're not well defined or sufficient. For example, it did say in the supervision requirements that 50% of the supervised hours could be by a provider that is not a licensed psychologist or a licensed practitioner, if that becomes the name, practitioner of psychology. And so that would open it up to other providers in the mental health field being able to do supervision. And there was some concern around that, that there should be a requirement for all providers to have a professional will. There was discussion, a few people commented on exceptions being made for behavioral analysis, that they have their own guidelines and maybe shouldn't be included as much in the MLA. And similarly, also for neuropsychological assessment, that there should be more clear distinctions around that. And then also for a school psychologist, that there should be more, clear distinctions around that as well. Okay, and so for the express support, in general, there was support in this idea of bringing APA up to date with this acknowledgement that these practices do already exist in the mental health world and that the mental health field is moving towards a multi-tiered system and has a lot of master's level providers. And so that APA would be just falling in line with this. That it would allow for more training and licensure of mental health providers to meet the increasing societal demand. So again, there was a number of statistics that were shown about how much need that there is in society, and this was seen as a way of trying to meet that need. That current master's level program exists without a national standard, and so the MLA would help facilitate consistent expectations across the country. That would be guiding master's level programs, and master's level members would give APA more influence so that they could maintain the gold standard of care. That the MLA upholds the title doctor for use only by doctoral level providers. So this was something that the MLA did do, that it did try to maintain that only doctoral level people could be called psychologists and could use the title doctor. And another thing that a number of people commented on was that they appreciated that the MLA expanded accreditation past just APA and CPA so that other accreditation bodies could be recognized as ways that individuals could become licensed in the fields. Okay. And so then I have a few questions, and in general, just based off of the discussion, these are some of the questions. I don't know if I should go through all of them. It is something that potentially we could discuss a little, but a lot of them are just kind of reflective of what I've already said. I do want to highlight the one at the end here, which is the statistics around how many master's level providers are joining the field each year, are graduating from programs each year compared to doctoral level. So currently there are 20,000 plus master's level graduates and only 3,000 plus doctoral level graduates each year. And so I just wanted to highlight that to discuss a little bit about the concern around how will that impact psychologists overall, and how will that impact how APA is representing them, right? Because if now APA is representing both, how do those numbers pan out in the future? All right. Gina, do you think any of these are ones that I should highlight?
No, I think that these are important things for people to think about. Does anybody have any specific questions that we can further address? There are other people I know watching this who might also have some insight. I don't want to call them out, but there are some other APA people, or former bigwigs in APA who might also be able to offer insight on the meeting. Well, if you do, you can either throw it in the chat or kind of raise your hands, and Maddie and I or somebody else will be able to answer it.
Yes, any other insights would definitely be helpful for our understanding. Oh, Dr. Oppenheimer raised his hand.
Oh,
Okay.
Thank you for doing this, Maddie. That is a great review of a very complicated issue that you haven't been sitting in for the past 4 years to pull together. So that's tremendous. Um,
Thank you. And thank you for joining. I'm very happy to have you here.
Happy to help out. So I think it's for people to think, what are the implications? These are a couple of major changes of what APA is proposing with the masters and what the applied psychologists want to do. What hasn't been really fully considered is what are the implication for health service practitioners? How is that going to impact your work and the field as we do it? So as people read it, without getting too much into the weeds again, it's to really think about what's the impact going to be, and is this good for the profession? Is it good for your career? Um, and kind of think through in that context.
Thank you. Oh, and Sue also has her hand up. Thank you, Sue. I'm happy you're here.
I couldn't resist. I've been talking with Maddie about this for quite some time, and I'm the APA rep for NISPA, and I also was the liaison for the from the Council of Representatives to the Board of Professional Affairs during a significant period of time when all this was happening. One area I think that does not get discussed sufficiently is this is separation of assessment from the actual ongoing process of working with a patient in therapy. It's as if one makes the assessment and then the therapy starts. And this is, as we know, not really what happens in the real world. We're always assessing. So I feel that this area is really insufficiently developed and thought about. Um, and similarly, the diagnoses change frequently, hopefully, as we think through and get to know more about the people we're working with. So there's some way in which there's, a simplification of the processes that troubles me. And again, that's not to say that there aren't valuable contributions of people at the master's level, but everything is rather unclear to
Sue,
me. And that's one of the concerns. Also, the issue of defining competency differential. APA spent a couple of years with task forces and so forth, trying to determine how did you differentiate the competencies at each level. And a significant document was presented to the Council of Representatives, and it was voted down. In that it was really, it's a really problematic thing, and yet we're proceeding ahead with a lack of clarity in this area. Is my personal opinion. So I think that these things are very hard to define. And I think the document, I think you should be considering the extent to which you feel the document adequately makes these definitions clear. And the comments are very, very seriously considered, but maybe the time limit is way too short. We don't know whether this is going to come to council in August or not, whether it will be ready. And every comment that's made has to be responded to as well. So this is still a document in process, and yet we have, what, 1 week left to get people to really take seriously the impact. So I just wanted to say that. And the other is people may feel that, well, we're in New York, we have great licensing laws. It's not going to affect me, but it will affect the entire field
yeah.
as far as I believe, and I'm sure others too. So
Sue,
thanks, Maddie. You did a great job.
wait,
Thank
Sue,
you,
don't go
Sue.
anywhere. Can
I'm
I
here.
ask, can I
Yeah.
ask you to just clarify your first point? Because I think that it's really important.
You mean about assessment?
Yeah.
Yeah, any of us who do ongoing work where it maybe isn't something that is a very quick, short treatment, and even then, our diagnoses change, our assessments change, where that's part of the process of doing the work. We're constantly trying to assess, and especially in complex situations, which increasingly our patients present with lots of trauma, and this whole society is in an uproar. And so the question is, how do we incorporate assessment in this, and why make it as though it's a separate individual issue?
Right. That's what I wanted you to highlight.
Yeah, that's how I am looking at this. It feels that that's not adequately. I'd like to hear what other people say. I don't quite know what that means. And also why the carve out only for certain specialties like neuropsych and forensic. Those are important specialties, but there are other specialties. And how does one prepare people to deal with these constantly emerging areas of specialization? What should be doctoral? What should not? What's the difference in the preparation to think broadly? Much was made about talking about complexity, and then I'll shut up because I really want to hear. But that the difference between the doctoral and the master's has to do with the preparation for working on a more complex level. But I don't see any of that in here in terms of really helping us understand the distinctions. In fact, I'm not even always entirely sure what we mean by that. So that's just what I want to say. Thanks.
Thank you. And Richard, you have your hand up?
Yeah, a little late to the rodeo here, so this may have already been brought up, but I have a real issue with the concept of equating master's level psychologists with doctoral level psychologists. And I have a background in both. For many a year, I worked as a school psychologist for 30 years, in fact. And even though I was, the senior, I ran the department at the end, I didn't have my doctoral degree until halfway through. And the one thing I really had almost no training in was counseling, was doing therapy. And as, time went on, more and more we were pulled out of our roles as testers, as testing machines, and more tasked with being psychologists. I wasn't trained for that at the master's level. I really wasn't. I was trained to be a testing machine. So, that's just my own little thing. The other thing is to note that my daughter, who's will get her PhD next month, she defends her dissertation, is a psychologist at Harvard now, and she talks about some other organization, the name I'm blank on at the moment, who is accrediting a lot of the universities for students who are really into doing research, and it's not APA. They're discrediting going to an APA approved site and more going towards this other one. Somebody here, if you know, please let me know. I forgot the name of that other organization.
It's PCSAS.
PCSAS.
Right. Okay. That's what's in vogue at some of the top schools, and APA got to get with it. It seems like they're missing the boat on all fronts. That's
Thank
it.
you, Richard.
My
Yeah,
can of worms.
and thank you for sharing that. And congratulations to your daughter.
Thank you.
You make important points. All right, Peter, you had your hand up next.
Yes, hi everyone. Thank you for the very clear and thorough presentation. Um, my most focused point would be to encourage everyone that comments to comment on this proposed title, which, as I understand it, is licensed practitioner of psychology. Everyone on this call is a licensed practitioner of psychology. It draws no distinction from the psychologist, the doctoral level psychologist, or a master's person. It further will obscure the difference between a master's practitioner and a psychologist. The public struggles so badly to know the difference on any of the professions and what the distinctions are. If we have a title that further blurs those lines, we will all be kind of associated, I believe, at the basic level in that regard. So what we call it is critical. I'm not sure what the good title would be. What comes to my mind is the way physicians have PAs, physician associates, or physician's assistants, rather. Something like that, a psychology associate is what comes to my mind as a title that would be clearer in drawing a distinction. And that is critical for the public because other than that, it'll be just a mishmash where we'll be associated with what I dare say is the lowest common denominator. Thank you.
Yeah, thank you, Peter. Yeah, there were a few articles that were put on the listserv about how important titles can be. Thank you. All right, Stephen, you had your hand up. Thank you for being here. Oh, you're still muted.
How's that?
There we go.
Oh, good. Thank you. This is very good. I, I kind of am in line with a number of things. I mean, intentions. For example, having more therapists out in the world is really very much needed. At the same time, I do think that these kinds of changes that are being proposed really should be rooted in some understanding of the existing research on some of the changes they're trying to make. I've heard people say that there's really no difference, for example, between outcomes to therapy from between master's degree folks and doctoral level folks. And while the research is somewhat nuanced, it deserves some attention. There are a number of meta-analyses that do suggest there is a difference. The difference in many of the studies seems to be somewhat small, but those studies generally involve the therapists, whether they're doctoral level or pre-doctoral, engaging in therapy that is very structured, very technique driven, and aimed at limited outcomes. So when you have everybody doing the same thing toward the same outcome, there's very little difference. But more advanced training is required for the kind of performance in therapy that would involve attention to relational issues, which tend to be the things that are the biggest drivers of change in the therapy situation, like the therapeutic alliance, and being able to flexibly respond to the needs of a patient in the moment effectively. That's a type of, I think of that as a kind of complexity, Susan. The work in that area suggests that this is this involves critical thinking and judgment and in the moment decision making with the patient, in collaboration with the patient, and it's really no less at a doctoral level than doing a neuropsych testing battery, deciding which tests to emphasize. It's one of the challenges that has happened is that our educational efforts in doctoral level have increasingly focused more on a very restricted range of what is psychotherapy. And the focus has been on a type of approach to psychotherapy that somebody at a master's level, and maybe not even needing a master's degree, could do by following the same steps. I guess what I'm saying in essence is that the decisions that are being proposed here really should take into consideration the science of psychology and really look at what is said there.
Yeah, thank you, Stephen.
You're
I agree. I think considering the science is very important, especially since it will affect the whole field.
Could I add one more
then
thing? Just and then I'll be quick.
Sure, great. Yeah, if it could be brief, because we have a few hands. Thank you.
In order to kind of give folks some way to maybe spread the word that this is a concern, I've been circulating a petition that people have been signing, and if it's acceptable, I could put that in the chat so people could actually take a look at it and see if they're interested in.
That'd be great.
Fine if you would like to share
It
it in
looks
the
like
chat.
the chat is disabled. I tried to post
I'm
something.
gonna try and figure that out.
Yeah.
So give me a
Okay,
few-
thank
let
you.
me- Let me figure
I
it
just
out.
want to thank Stephen, and I know I'm jumping ahead because that is the clearest statement I have heard of what I have been articulating, but this is so beautifully done. I'd like a copy of that, truly, because in the end, I'm the council rep. I'm the one who's going to have to stand up on the floor if it comes this summer. And advocate one way or another as well. So we need the comments, but that's beautifully done. And also there has been
Well, welcome.
problem articulating that complexity. That was a question actually that was raised at the BPA Town Hall, Board of Professional Affairs, and Lynn Bufka, who's the director of practice, the head of practice now at APA, was saying, well, it is complicated. There's really not so much research on that issue, and you're articulating what I actually know to be true. There is research, so we have to get that out there. So thank you. I want to see what
Wonderful.
you've
Thank
got.
you.
Okay,
Thank
that's
you.
it.
Yeah, thank you for sharing the research. And Richard, thank you for being so patient. So I see you had your hand up for a bit. And just in general, because I would like to be able to go through a little demonstration. So if we could just be succinct, but I'm very happy that there's so much participation. Thank you, Richard.
You're welcome. And thank you for the presentation. It's wonderful. I'm a current doctoral student. So I came because I'm a fifth year, and this, if it passes, will be soon too. It would affect me. So I decided to sit in and try to learn, and this was very clear. So I appreciate it. One of the things that I was thinking, two of the things that I was thinking about is in the programs that I'm in, we focus a lot on cultural competence, which is, and I got a master's and now I'm getting a doctorate. And I can tell you in my master's program, they didn't really focus a lot on cultural competence or how to be more fluent with different kinds of clients. And so to conflate terms, I think can be kind of difficult or can cause some problems. And I think along the same lines, we already see I guess, an emergence of concept creep. So like people are looking at things and calling everything trauma. And there are some very serious issues that people go through, but they go on social media, they hear the word trauma, they hear the word autism, and they immediately start to get confused or start to get panicked. So I'm thinking about the same way that people get confused along the lines of diagnoses, if we start to confuse people along the lines of who is an appropriate provider versus who is not, that could also cause a challenge. So I think that's my 2 cents on the what I've heard so far.
Thank you, Richard. I think you make very valid points. There's a lot that goes into the field. And congratulations, you're almost done with your doctorates. You'll be
Thank
Dr.
you,
Richard soon. Congratulations.
thank you.
Thank you for commenting. All right, Emma, I'm sorry if I hope I said that correctly.
Very close, Amma. Also, congratulations, Richard. It's also good to see you. So I think the question that I have maybe has more to do with like APA's role in well, I'm already kind of starting my question off wrong. So I'm early career. And I think the thing that I've seen a lot, especially from like people I know who have like some type of master's degree within like the field of mental health, is that why should I go to school for X number of years and get into X amount of debt when I can just go to school for like 2 years and then do the same thing as you? And so I think the thing that comes up for me a lot in this conversation is that getting your doctorate is inaccessible in a lot of ways for a lot of people. And so if APA like really wanted to advocate, or if they really were like interested in protecting the field, then I feel like more energy or more time or more space should be given to making things more accessible. And so like for me, as a Black woman, I'm also like aware of the number of other Black people who are also psychologists. And for a lot of us, it does have to do with means. But I never really hear much about like, how can we make things, how can we push for more scholarships, or how can we like lobby to, really push to change the costs of things. And so it just seems like this is just kind of adding more to this whole like let's find another way to make money so that we can get more people out there, but like we're also sacrificing quality of training. I work at a university counseling center, and on a global scale, having a doctorate in psychology still matters. So other countries are not looking at master's level degrees. They want things signed by MDs and PhDs and PsyDs. And so that cannot get lost. So I don't know if that is like a part of this conversation or yeah.
Oh, that is absolutely a part of this conversation. I think you worded that wonderfully. That is a significant part. Well, that was part of like not considering the long-term repercussions of this, right? How does it impact psychologists? How does it impact people wanting to get their doctorate degree? And everything you just mentioned. Dina, go ahead. You had a comment.
I was going to say, Amma, this was a huge, I was involved in the fight against part 2 of the EPPP. And this was a huge discussion, and we were like, making a master's level practitioner doesn't help with the biases that are out there and the inaccessibility for certain communities to access their PhD, and it just waters down care. This isn't an answer to access to care. So I think the way you phrased that and the points that you brought up are really important and salient to this discussion. Absolutely. And I think that if I could give you a megaphone to shout that to APA, because that to me, that and the title are huge. Yeah.
Yeah, and I think that's part of the concern with the lack of research, right? That we're kind of making assumptions about what master's level providers, where they're going to practice and what they're going to do, and that it won't impact people getting their doctorates. It's a lot of assumptions without research backing it up of like, how will it actually impact the field? And instead of advocating for things like insurances paying more so that providers could make an income, right? Instead, we're focusing on what seems to be kind of like the easier route, in my opinion, which is licensing other degrees. Okay. Carla, thank you for your patience also.
No, that's okay. Thank you so much for bringing this so clearly and so concisely to the membership here and also with NISBA. And I really feel like it's very valuable to just reinforce Maddie's efforts, that I think it's gigantic that we need to get on, make our comments. The line by line that she's illustrated for us is so critical, because this document is a mammoth and the time frame is so short. And if you go on and you see how to comment, it is line by line, and they want specific comments. So you can have your own comment about it, but it's extremely important that you see that this is the way that they are expecting you to comment. If you just have a general comment or you email them, it's just not going to be as impactful, right? So that's one. And Stephen Long's really support his petition and his initiative, because I feel like this is the grassroots effort that we need. If there's no money, there's no advocacy. If there's no advocacy, it just gets lost. And we're really struggling for my whole career, and I'm a 32 plus career person. From the time that I was licensed, people are saying private practice is not going to be a thing. So each time we have to really bring up these points in a very clear, documented way with advocacy and money behind it through petitions. Otherwise, we're not going to get what we really need and what we really deserve. And the other thing I just wanted to say is I think that there's valuable places for master's level people, like group work, things that we can't always get to. I met a Ozark psychiatrist and psychologist at a wedding. And these are people that are doing very difficult, hard work in an environment that a lot of people don't want to be in. So if there's significations of people doing specific things without leaving go of the title psychologist, and what about counselor? What about group specialist? What about, these things that I think would be valuable? So just my 2 cents.
Perfect. Thank you so much.
Please comment, even if it's one comment, anything. Our numbers are so low on that, as Dina had pointed out. It's just it's not going to be taken into any sort of consideration if we're like 5%. of anything. We need to have like huge numbers. So if you know anyone, if you can tell anyone, people who are in training, people who are not, people who've been here for a long time, please send out the word. And just, even if it's just one comment, make sure your voice is heard, make sure your name is up there with your PhD or your PsyD. And I just feel like that's the way that we're going to be able to push back a little bit and have them reconsider it. And especially, like Susan was saying, we need more time to really make an impact in our voices being heard. And thank you all for so much for being here. And I sat in Peter's discussion Sunday, and it was very helpful. And thank you, Maddie, again. And take care.
Thank you,
I hope we
Carla.
have a real advocacy with this.
Thank you. I appreciate that. Yeah, and
Absolutely.
before we get to the last raised hand, I just want to second what Carla said, that it seems like APA is only considering comments that are in the commenting portal, right? So even if we email them, even if we speak up during town halls, they're only considering what's in the comment portal, which is why it's so important for us to comment in the portal. And that's why we're going to give a little bit of a demonstration for commenting. They want line by line, but even if you did one comment, it's better than not commenting. And so there's 2 raised hands. So Samantha, thank you for your patience and thank you for being here.
Thank you for letting me talk for a moment. The thing that jumped out at me and struck me is that throughout my training, it was stressed, you only do the work you are trained to do. And two, it's in our ethics. If you are not adequately educated and experienced in dealing with eating disorders, then you don't treat people with eating disorders. You refer them to someone who is a specialist in eating disorders. And this just feels like a complete throwing that all out, like baby with the bathwater, just toss it out. We don't need all of this experience. It blows my mind that this is the direction APA feels like we should go in by de-emphasizing the expertise of the doctoral level psychologist. So I just wanted to add that.
Well, thank you. And thank you for the passion. And I hope you share that in the portal so APA can hear the passion also.
Oh, I will.
Okay, perfect. Good. All right, Peter, you have your hand raised. And after Peter, I'm going to try to go to the comment portal.
Yeah, sure. Just on the comment portal, if you want to make just a general statement, you can put that in the label it as the introduction section. Don't feel you have to fit in exactly how they do it. It's up to APA to manage to organize all this. The portal, to be polite, sucks. It is extremely difficult to use. Today, I was struggling with, after I entered 19 items, it would not let me enter the 20th. And I've got 6 pages more of comments to go. I wrote people at APA. I still don't have an answer. So it is a very frustrating process. Do the best you can. But just understand that it's an embarrassment, I think, for APA to put out something so bad when they have all the IT resources. But if the best you can do is to do one comment, stick it all up front, and let APA deal with that. Thank you. And thanks everybody for the input, and it's been great to hear this.
Thank you. You've done a tremendous amount of work. We appreciate it.
Yes, thank you. And Sue, you're muted.
You missed my congratulations. But I did want to add that though this is the comment portal only, it is actually, in my experience, APA will respond also to enormous pressure. So I think that petition is fabulous, even if you don't even have to enter the whole thing. Lynn Bufka, whose information I will again post, I don't have it right in front of me now, is the chair of practice. You can write to her directly if you have sufficient numbers, for example, and you can also make group comments. Your association can. Divisions of NISBA cannot, but regional associations can make comments as a group reflective of if you can come to some kind of consensus of things you want to deal with. And so it's complicated because you also want to be mindful of the fact that not everybody has the same feelings. So thank you again. I've got to run, but bless you, Maddie, you've done quite a job. You've got
Thank you for
my,
being here again, Sue. It was very nice to see you and have you here.
it's great. I'm heartened to see the amount of interest. So thank you.
Okay, very good. Well, that was lovely to have so many people participate and share their insights. I'm going to go into the commenting portal now so we can have a little bit of a demonstration. I know it's getting late, so I appreciate everyone sticking around. Okay, so I'm going to share my screen again. Okay, does that look appropriate? Can everyone see it? Yes? Okay, very good. Okay, so here is the way that you start going into the comment portal. All right, so commenting.gov.apa.org. And at the end of this, to everyone who participated, I could send out all the information and some of the handouts that I had made that have visuals and summarize the information. And so you'll also have access to the link for this. So when you go on to this page, you want to scroll down to the bottom. So you also don't have to be an APA member to comment. And so then you could register an account and be able to comment. If you are an APA member, which I am, you could log in just using your credentials to log in. Okay, so I'm just going through the process on my account so you can see it. Once you are logged in, you are brought to this dashboard. You will see two items on the dashboard. The one that we're looking at is the MLA comments, not the APA comments, the MLA comments. Okay, once you click into the MLA comments, okay, it brings you to the commenting portal. Okay. When you go down here, you can see all the comments if you would like, right? And so this is a way that I was able to see in general who is commenting, how many comments there are, what are some of the concerns or support that is being expressed. So if you did want to view those, you could. Okay. And then if you click the proposed updates to the Model Licensing Act, okay, this is where it brings you into where you are actually making the comments. Okay. So here is where it's important to have the lines and the sections. As I think Carla and I think Peter pointed out, if you feel this is cumbersome and it's too hard to follow their exact way that they want this listed, it is okay to make one big comment. However, this is the way that APA is asking, that it is line by line in specific sections of the document. All right, so the document is the Public Comment Model Licensing Act. So you would click that, and then you can go into all the different sections. Okay, and so this is why I had listed, and I have a handout that I could send to you where it lists some of the items that I highlighted and what section they are in. So for example, the new title for a master's level provider is in the definitions section. Right, so if I wanted to comment on the title, I would put the section for definitions. And then I would put the line number. And so this is where you would need the line number, which I don't remember off the top of my head, but I think it was like 171. So then I would put the line number. And then you could put here if you were representing a group. So if you did want to comment for a number of individuals who are expressing similar concerns, you could put your overall group, right? So you can comment as an individual, you can also comment as a group. And then you would go and you would add your comments. Okay, so you have to actually click this little pencil, and then you would go and you would enter your comments here. So it breaks it down into sections. So what is your comment about specific language that you highlighted, right? So that line number has language in it for what APA is stating and regulating in the MLA. So you could discuss like comments around the language. What is your rationale for why you are thinking that way and why you're suggesting whatever it is that you're putting in this, and just general comments. So then after that, you can submit your comments. So then that would submit one comment, okay? And then you could go back and you could submit additional comments. And so then you would follow this the same way, all right? So you would add a new comment here, okay? And again, we would go in. There's only one option for the document because we're only commenting in this portal once you're in this section on the MLA. And then you could go to whatever areas you would like again. So if you had another concern about a different area of the definitions and a different line, you could put that too, right? Same thing. You go in, You make your comments, you add all your comments. All right, and so then when you're done with all your comments, you should have a list of all your different items. And as Peter pointed out, apparently you can only have 19 as the top amount of comments. Hopefully that is adjusted. So you can go in here and you could go through each of these, and then after you're done and everything is entered in here, you can submit comments. Someone had recommended having everything written out on a Word document first, so that this way you can copy and paste. Okay. And so you could write out your own little organization of what is the section, what is a number line, and what is your comments. And then when you go into the portal, just copy and paste everything into the appropriate section. So any questions about this?
Maddie, what's the deadline again?
The deadline is very soon. The deadline is March 3rd, which is next Tuesday. And since this Tuesday is basically over, it is less than a week away. Right. So next Tuesday is when the commenting portal will be closed.
If anyone on this chat or conversation has questions about how to do this and they want Maddie or I kind of to hold your hand and go through the document or go through how to do this, we are more than happy to do that with you. So
Oh, absolutely. I would love to get on a phone call, a FaceTime, whatever,
right,
and be
whatever you need.
supportive.
So I'll throw our emails in the chat so that you can kind of email either of us. Richard, did you have a question?
Yeah, so I was gonna ask if you are writing something out, and I know you recommended to do the Word document, but let's say you make a comment and you're making several, which I might do, and you accidentally put something for, let's say, definitions in the wrong section. Is there a way to edit, or do you just have to live with it and hope that APA catches the mistake, so to speak?
That is a very good question. I'm not sure about that one, unfortunately, because I haven't made comments yet in order to just like maintain my portal so I could demonstrate. But what I've seen from reading through the comments is that some people had accidentally commented in the wrong section and they just left it and said they didn't know how to change it. So I think you would just have to kind of push forward. I'm not sure if there's a way to edit it after you've submitted everything.
Thank you. And yeah, I might need some help navigating this, but I'm more than happy to um, provide input if that's helpful.
Oh, that would be very helpful. That would be wonderful. And whatever support you need, I'd be very happy to, and Dina as well, to just whatever you need, get on a call, whatever it is. Dina, or does anyone else have an answer specifically to that question?
I have gone back and corrected by hitting the comment pencil or whatever that is, and it's let me make some changes.
Oh, perfect. Okay, that's good to know.
Thank you.
Okay. Any other questions about the commenting portal? I could also bring up the actual MLA so that you can see the sections and you can see the line numbers if that's helpful, just to get an idea of how you're using those when you comment. Oh, they're right there. Thank you for circling them.
Sorry for my bad artwork, but those are the three documents: a full version of the revision, track changes, and the old 2010 version.
Yes, thank you for
However
highlighting that.
How do you get rid of that? I don't know.
I am not sure.
Sorry.
No, I'm glad that you highlighted it. It's right there for everyone to access. Okay. Okay. Any questions? Anything else that I would be helpful if I demonstrated? Dina, anything that you would like to add?
No, thanks so much for putting this all together. I think this has been hugely helpful. Maddie and I are gonna disseminate any of the graphics that she's made and this entire presentation. If you know of anybody who has any questions, both of our emails, including Maddie's corrected one because I mistyped it initially, are in the chat. So you can please reach out to us. We'd be more than happy to help. Dr. Warshaw also is the APA rep for New York State. So please don't hesitate to contact her. Really, any of us on here would be more than happy to help you. So don't hesitate to reach out.
Yeah, and just very quickly, I'm just going to show you the MLA. Do you see this?
Mm-hmm.
Yeah, perfect. Okay. So just so you can quickly see it, so you can see how it has all the line numbers, it has the sections here. The green boxes you don't have to comment on. The green boxes is just APA explaining their rationale or the different sections. So you're only commenting on the italicized white areas, right? And so this is where you can see that it has the sections. So section B here, right? We can go down and we can see that it has the new term here, licensed practitioner of psychology, right? So if you wanted to comment on that, then we know that it is in the definitions section and it is line, where did I just, right here, right? 114, licensed practitioner of psychology, right? And so that's just so that you have an idea of why it asks for the lines and the sections. Okay. All right. Anything else before we wrap up for tonight?
I've been trying to raise my hand. I don't know why. I just can't figure it out. My name is Josh Glazer. So I'm a early career psychologist. And I was reading about this proposed change. Like I said, like makes its way around my social circles, and I just wanted to just like echo what I keep hearing, which is just like concerned about confusing the public view and frustrating like doctoral students who spend like 5 to 7 years of our lives or more preparing to provide excellent care for patients who really deserve our level of training. And it's just disheartening that this is something that would even be in consideration. I just wanted to echo what I keep hearing in my circles and just make that heard. I'm sorry I couldn't raise my hand.
Well, I'm glad that you participated, and I'm glad you just jumped in. And especially as an early career psychologist, it will have a longer impact on early career psychologists. So I'm glad that you're here, and I'm glad you're sharing your perspective. Okay. Well, thank you so much, everyone. It was so nice to have so many people here, and especially people who are so versed in this area. And thank you for coming, even though it's late in the evening, and sharing the night with us. Dina, anything you would like to add before we wrap up?
I think that there are people here who aren't necessarily from SCPA from all over the country, and we really, really appreciate you being here. We are not the only ones doing this and kind of raising the alarm. If you have any questions, please, we are more than happy to share our expertise and slides and kind of help get the word out there. So please don't hesitate to reach out.
Can I
Yeah, I
ask
second that.
one? Can I ask for an access need? So I have old man eyes. So would you be able or willing to read out the email so that I could just type it? So I don't have to like squint and to read.
Yeah, you ready?
Give me 1 second.
Okay.
Go ahead.
Okay. I'm gonna start with mine. D as in David.
Okay.
A as in apple.
Okay.
B as in boy.
Okay.
B as in boy. E as in elephant. I always get that one wrong. PhD as in doctor. At gmail.com. And then I'll give you Maddie's.
Okay.
Okay. D as in David. R as in Rachel. Y as in yellow. E as in elephant. L as in Lucy. L as in Lucy. I as in Indiana. No. C as in car. O as in Oregon. I'm getting these all wrong. At gmail.com. So it's Dr. Yellico at gmail.com and D Abby PhD at gmail.com.
Thank you so much.
No problem.
Yeah, and I will try to send out slides and send out the outlines that I had made and some of the documents that I had made, so everyone has access to that.
Yep.
So just want to finish up. Thank you so much to Maddie and to Dina for running this tonight. Maddie, you've done an incredible job of putting together all of the slides, the PowerPoints, and everything. It's just you've been doing incredible work here, and we are incredibly grateful to you. So thank you again. And if you are not a current member of SCPA and you would like to join us, there is a link on our website. We're happy to have you. You do not have to be in Suffolk County to join us. We are happy to have you no matter where you are. And we are a wonderful group of psychologists, and we will stay a wonderful group of psychologists. So please feel free to join us. And we have continuing ed workshops all the time. And we really are a wonderfully collegial group of individuals. So please feel free to join us. I guess that will conclude our town hall for this evening. Again, if you have any questions or concerns, please feel free to reach out to Maddie or to Dina. You can reach out to Dr. Warshaw. She put her email address in the chat as well. You can reach out to me or anyone else if you have any questions or concerns. So thank you again.
Can I just ask Stephen Long to be in touch with me, because I want his references. They're very important. Thank you.
Absolutely.
Thanks.
All right.
Where did you say the link was to join SCPA? I'm in Huntington. I'd love to get involved.
Yeah, absolutely. It's right on our website. It's on suffolkpsych.org. And there's a join link right on the homepage.
I spelled that one right.
Thank you.
Yes, you did. Would be happy to have you.
Yep, we're a great group.
All right. So
Great.
thank you again,
Thank
everyone,
you,
for coming.
everyone.
Thank you.
Have a wonderful evening.
Thanks.
Good night.
Good night, everyone.